Okay, and with that, I'm Mark Pinto, and I'd like to welcome you to Phoenixville Public Library's Zoom channel and our presentation tonight, Medicare 101, Medicare from Soup to Nuts, brought to you by two counselors from PA-MEDI, and they are Jim Armour and Linda Matz. Jim and Linda, thanks for doing this for everyone tonight. As I mentioned, please type your questions into the chat during the presentation, and they will be addressed by our presenters as we go along. So sit back, relax, and take it away, guys.
I will. Welcome, everyone. As we were introduced, I'm Jim Armour. My co-presenter tonight is Linda Matz. Put the first slide up, if you would, Linda. We are PA-MEDI certified by the state of Pennsylvania Medicare counselors. We are working under the auspices of the Department of Aging here in Chester County. PA-MEDI, which is normally known as SHIP elsewhere in the world, but in ARC, we have a unique name. It is a free service to provide you independent and unbiased confidential health insurance information and counseling. Our goal is to let you get the most out of your Medicare benefits that you've worked so hard for. All of us, Linda, myself, and there's probably about 30 other volunteers, we can not make any financial gain off of any decision anyone makes. We're totally independent. Slide. So how do you contact PA-MEDI? Well, you can call the nearest Chester County Senior Center and ask for an appointment with a Medicare counselor, and they can set you up. There's usually services once a week in almost every, in fact, I think every senior center. You can also check for other counseling sites on our website, which is provided there. And if you have questions and you'd like to make a phone call, call the 610-344-5004 number, and that's called our helpline. And the helpline operates Monday through Friday from 9 to 4. Please leave a message with us, your name, phone number, and a short message of what you're trying to get help for. If you have a specific time or day you would request a call back, please leave that also. Otherwise, the volunteer will take you as you come in. Usually they'll call you back the same day, but no later than 24 hours. Or you can email your question directly to our supervisor, Sarah Milam, it's smilam@chesco.org. And she is our county coordinator for the PA-MEDI program. And she will get back to you via email or phone, your choice. Slide, please. So here's our agenda tonight. We're going to explain to you the various parts of Medicare: A and B, supplemental plans, Medigaps, Part D, that's for drugs, D is for drugs. And remember, drugs are our friends. Medicare Advantage plans, that's also known as Part C. How and when do you enroll in these plans to avoid penalties? This is getting more and more important. And what to do if you're working past 65. Slide, please. The most confusing terminology in the English language has become Medicare and Medicaid. They are different. Medicare is the federal program designed for senior citizens and people with disabilities. It is run and overseen by the Center for Medicare and Medicaid Services, but it's really Medicare that they oversee. Medicaid is a state program. Now, there's a lot of federal funding that goes into Medicaid in each state, but it's designed for people with limited income and resources and to help them with their medical bills. This is administered in our state by the Department of Human Services. Slide, please. How do you qualify for Medicare? First of all, you got to be at least 65 or older. Or if you're under 65, if you have certain disabilities, you can qualify for Medicare, such as end-stage renal disease, Lou Gehrig's disease, or other disabilities that are determined by the Social Security Administration that you are permanently or temporarily full-time disabled. You must be a U.S. citizen to qualify for either program, or a legal immigrant who has lived in our country at least 5 years. Medicare is not the same as Medicaid. Keep that separate. You can have both programs, but we'll tell you how you differentiate and qualify for both. We're going to start out with Medicare first. There are two ways to take your Medicare when you retire. On the left-hand side of the screen is the traditional roadmap for Medicare, traditional Medicare. And on the right is what you see mostly advertised on TV, the Medicare Advantage plans. Do you know what you're missing today? So we're going to talk about each of these boxes, but we're going to start with the traditional Medicare plans. Slide, please. Part A covers hospital insurance, in-facility insurance, hospice, can be in your home, your blood that you need for transfusions or whatever, skilled nursing home care when you're in there. That's what Part A is. This also includes psychiatric hospitals. Slide. Part B is just about everything else except drugs. It's the cost of physicians, surgeons, outpatient care at the hospital, your preventative care where you go for your annual blood work to make sure your chemistry is doing good. Bloods and drugs given as an outpatient setting in a facility or in a doctor's office is also covered, but not prescription drugs that you pick up at a drugstore. We'll talk about that later. You get x-rays, occupational and physical therapy, and durable Medicare equipment. Slide. Services that are not covered by original Medicare. Just about all dental is not covered. There's some extreme examples, but by and large, dental care is not covered. Routine eye exams and corrective lenses are also not covered. However, if you have diabetes, you can get an annual eye exam and Medicare will cover it, other than, I think it's $45 copay. Medicare does cover diseases of the eye, cataracts, other diseases of the eye that you run into. Medicare does not cover hearing aids, cosmetic surgery, long-term care, and once you leave the United States, you're on your own. It's only good in all 50 states and our 7 territories. Slide. Medicare is not, like you probably guessed from some of the people that run around and talk, it is not free. You're expected to pay additional money for this. Let me explain. Part A, if you've worked for 10 years, 40 quarters, they don't have to be contiguous, but a total of 10 years, you will pay no monthly premium for that. However, remember, Part A covers hospital care. When you go into the hospital, you will be charged $1,676 for the first day through the 60th day. Doesn't matter how long you stay in there. If you go over 60 days, there's other charges. Part B, there is a monthly premium that everyone must pay. It usually is taken out of your Social Security, or if you're not on Social Security at this moment when you sign up, you'll pay for it quarterly in advance of the quarter. The Part B deductible this year, and there's an annual deductible, is $257. after which Medicare kicks in and Medicare sets the price on everything. But after you pay that annual deductible, you will pay 20% of the Medicare allowed cost. Let me give you an example. You go to your GP, routine visit. GP bills Medicare $180. Medicare says what you did for Linda, we only pay $100. Because your physician, and you should always ask this, accepts Medicare for payment, they will write off $80 for the $100 fee that Medicare has promised. Only Medicare is only going to send them $80. And you are going to have to pay the other 20. Slide, please. So that's A and B. How do you handle that 20% or those hospital fees? Because it's every 60 days you go in the hospital. You can be out for 90 days and go back in. It's another $1,675 this year. So Medigap policies, they're also known as Medicare supplement plans, offer a way to handle this along with your retiree plans, if you're fortunate enough to have one these days, or the Veterans Administration and TICARE. Slide, please. Oh, the special note for veterans on the bottom there. All right. Anyway, the plans that are covered under the Human Resource Department to verify how your retiree coverage may work with Medicare. So if you're thinking about working or going on Medicare and you still have coverage from your firm that you're working at, you need to talk to them because it varies from company to company how they work with Medicare. But as a retiree, you can get supplemental care for your Medicare with your employer-sponsored retirement plans. Or if you're a federal or state retired employee, that's the coverage. Retired public school employees retirement plan, known as HOP. Or TRICARE for Life, which is a veterans program. If you've served in the military for 20 years or more, or you've been honorably discharged with a disability, you qualify for the veterans plan, which is known as TRICARE. So you can use either Medicare or you can use your veterans benefits, but you can't use both. So if you're in that situation, talk to a counselor about how you can balance it for the best use. Slide, please. So Medicare supplements. These are designed to pick up that cost, that 20% cost and other deductibles for hospitals so you could go broke if you have a terminal year because there's no cap on that 20%. These policies offer you that cap. It only works with original Medicare, not Medicare Advantage. That's a separate category. We'll talk about that down the road. And remember, these plans do not include prescription drugs. Prescription drugs, when you take Medicare standalone, is a standalone program. Slide, please. There are 11 different Medicare programs. If you retire or turn 65 after 2020 or during 2020, only the ones shown on this slide are qualified. You do not qualify for C or F. But these 3, 6, 7, 8, 9, and the asterisk on the G means there's a high deductible version of G, are the plans that are available to you. What's important to understand is once you decide on a plan, that plan is offered by a number of insurers. In fact, we can give you a list of 39. It should have been in your handouts. That plan is identical. Nobody can give you a better benefit in the plan. The plan G is a plan G is a plan G no matter who you buy it for. The only difference is the price you pay. Now, which plan works best for you and your medical needs? Seek out a PA-MEDI counselor at one of the senior centers or other locations, and we can walk you through your options so you know what's the best plan for your needs. Slide, please. All supplement plans are exactly the same regardless of the insurance company, but they are independent of the government. They are private insurance, but the government sets the terms of each of those plans, and they cannot be altered. They will increase their basic cost is based on your age, your gender. Women get about a $15 or $20 a month better quote than a similar man. Do you smoke? If you smoke, you're going to pay more. And where's your residence? Unbelievable, but Philadelphia is one expense and Chester County's another. So it's all based on your zip code. The prices of all those plans vary from $40 to $200 a month by age 65. And what's the difference? Well, if you're paying $200 a month, you're going to pay the annual deductible and nothing else, no matter how bad you have a year. And you're just going to pay your premium. If you're paying the $40 end of the deal, that's the high deductible plan, which your counselors can give you more information on, or you can refer to your Medicare.gov book that you probably received in the mail. All the rates will typically change annually, and they will go up. The older you get, the more you will pay, regardless of your plan, regardless of your health. Once you have the plan, no matter how bad you are, you cannot be dropped. You cannot be charged more than a healthy individual in that plan's group. Why is the plans good? Well, it's good anywhere in the US. Just like Medicare, it follows the Medicare. So if Medicare is accepted as a provider wherever you are, then your supplemental plan will be accepted as well. Slide, please. So that brings us to our best friend, drugs. Slide. These are standalone prescription drug benefits. You can purchase this standalone plan. They're sold by private insurance companies. And it's only for prescription drugs. If you have chemotherapy in a doctor's office, that's under Part B. If you have an insulin pump and you go in for refills, that's under Part B if it's done in a doctor's office. But anything that comes over a pharmacy counter and requires a script, that's part of Medicare Part D. Not all plans will cover all drugs, so you need to review the plan that makes the most sense at the lowest cost for you and your drug needs. All plans have monthly premiums and copays, depending on what drug it is. And some may have a deductible, but that's getting rarer and rarer these days. All plans have to be approved by CMS, so you know what you're dealing with. And remember, Medicare Advantage includes drugs. And we'll talk more about that in Linda's segment. Slide, please. So how does the prescription drug plan work this year? So you pay the plan's copays and premiums have been pretty low until this year. But depending on the plan you choose because of your drug combination, you will pay copays, and there are some co-insurances. If your drug is in the class that requires a deductible, the maximum that can be charged this year is $590. But like I said, that's getting rarer and rarer. A good thing that's happened this year is we have a $2,000 cap. So you will not pay out of pocket more than $2,000 for your entire year's worth of drugs. This does not include premiums. It is only copays. Slide, please. So that takes care of drugs. We have any questions at this point?
Don't see any.
Okay. Do you want to take a break or move on?
I'm okay to move on.
Let's
Yes,
move
me
on.
too.
Move on.
Linda's next, and she's going to walk you through Medicare and the rest of the program.
So we saw this picture once before, and Jim covered everything on the left-hand side, which we refer to as original Medicare with a Medigap or a Medicare supplement plan, and then a prescription drug plan. I'm going to talk primarily about Medicare Advantage plans, and then we're also going to talk about how you enroll to these plans. So the Medicare Advantage plan came about in the mid-2000s. The idea was that at that time it was felt that managed care plans seemed to be doing better at managing people's health care than Medicare may have been doing all by itself. In order to purchase a Medicare Advantage plan, though, you still have to sign up for Medicare Part A and Medicare Part B. One of the big differences with the Medicare Advantage plan is that they are private insurance companies that have been approved by Centers for Medicare and Medicaid. They will have some type of monthly premium, and key to them is how they're different is that they have networks that you have to stay within the networks of your plans. And depending on the type of plan, you may or may not have to stay within a network, or you may be able to say go out for one physician and pay a higher cost. They definitely have co-pays and co-insurances with all their services, and you have to take their drug plan, their drug benefit. So as we said, you have to have Part A and B. Keep that in mind as we talk about Medicare Advantage plans. They are plans that have been approved by Medicare. They basically are still part of the Medicare program, but they're offered by private insurance companies who have contracted with the Centers for Medicare and Medicaid, CMS. Provider networks do vary plan to plan. The key to a Medicare Advantage plan and being successful with it is that you want to check with the providers you use to determine that they are in the network of a plan that you're looking at signing up for. It could mean a significant chunk of money if you sign up and your care providers are not in that network. So you want to be sure to do that before you sign up for any Medicare Advantage plan. Plans do have monthly premiums, and they do have co-pays and co-insurances for various services. And they typically do include prescription drug coverage. I don't think I recall more than one or two that were available last year that did not have prescription drug coverage. So the most common types of Medicare Advantage plans are something called a health maintenance organization, which you're probably familiar with, and also a preferred provider organization. There are some special needs plans, which are typically for people who are on either on Medicare and Medicaid together, have some type of long-term chronic condition, or someone who has is in an institution like a nursing home. And again, the Medicare Advantage plans have to cover the same benefits at a minimum that original Medicare has. The thing that you see advertised a lot on TV, especially during open enrollment season in the fall, is all the additional benefits that Medicare Advantage plans can offer. Things like dental, hearing, and vision. And some of them go as far as offering transportation to medical appointments or meals after you've been hospitalized, and then over-the-counter benefits. The dental, hearing, and vision benefits all are some type of partial benefit. There'll be a certain percentage that they cover, and then a certain percentage that you would pay out of pocket. But every Medicare Advantage plan has what's called a maximum out of pocket, and they'll have a certain number that When you've reached that number out of pocket, things, and procedures, doctor visits, et cetera, after that, will no longer come out of your pocket. This is a comparison between using a Medigap plan or a Medicare supplement plan with Medicare, original Medicare versus the Advantage plans. And some of the key things in it is with Medicare with a Medigap plan, you can use any hospital or doctor or outpatient lab or any healthcare provider that accepts Medicare. You don't typically need referrals. If you want a drug plan, you have to purchase it separately, although you can switch those plans every year. There are not the extra benefits that you may get with Advantage plan. And with a Medigap plan, there may be underwriting for you if you want to switch the plan after you've been on it for a while. Whereas Advantage plans do have networks, and they're usually local networks, so that if you're going to plan to travel outside the state or outside the benefit network area, they may or may not cover you. They are required to cover you for emergencies, but for routine medical care, for instance, originally when these came out, many people who go to Florida every year wanted to get their, say, for instance, get their blood pressure checked while they were there. But because none of the networks had providers in Florida, they weren't able to do it. So you'll see more networks expanding their network a little, especially Blue Cross has expanded some of their networks into Florida. They usually do cover the drug plans. We mentioned that, but they still have co-pays and deductibles. You may need a referral from your primary physician, and you'll be either assigned or you'll choose a primary physician when you sign up for an Advantage plan. And you can switch them annually. And they do have that maximum out of pocket. So how do you enroll in these? Excuse me while I get rid of my almost coming cough. Okay, if you are currently collecting Social Security, retirement, or disability payments, you will automatically be sent a Medicare card prior to your 65th birthday or the 25th month of your Social Security disability. And the card will come and it will have your A and B on it, and it will explain to you what your process is at that point. If you're not receiving Social Security when you turn 65, you have to take some action and make some decisions. One is that you just enroll in Part A because you're going to continue to work, and your work is going to continue to cover you, so you don't need Part B for your outpatient. Or you may you're not going to continue to work, or your company says, nope, you're going on Medicare, you got to use that. You will want to sign up for A and B. You can do it online through Social Security, ssa.gov, and there's a specific option in there for Medicare sign up. You will have had to sign up for Social Security in the sense of having received your Social Security number, et cetera, but you probably have if you've been working. Or you can go to the Social Security office or call the Social Security office to do it either in person or on the phone. So when do you actually enroll? The specifics of that. So if you want to enroll in Medicare at age 65, you can actually sign up for Medicare beginning 3 months before your 65th birthday, the month of your 65th birthday, or 3 months after your 65th birthday. We usually recommend people try to sign up before their 65th birthday. For instance, if you sign up today, your Medicare would start, if you're after your 65th birthday and you sign up today, your Medicare would start the following month, the first of the following month. If you still have a group health insurance program after 65 that you're getting through your employer, you can defer A and B But that must be with an employer that has at least 20 employees. You may enroll in A as a secondary coverage to your hospitalizations, but we encourage you to, if you're contributing to an HSA or a health savings account, or you may have a premium for Part A because of your income, that you really check on that before you enroll in Part A. There are some penalties with an HSA and Medicare if you continue. You basically can't contribute to your HSA after you sign up, but you can utilize the funds that you've already had in there. If you're a person who's been on the healthcare marketplace or Obamacare, or in Pennsylvania, it's known as penny.com. When you become eligible for Medicare, you can no longer use the marketplace. And the reason is that when you become eligible for Medicare, you lose the subsidies that you had prior to becoming eligible for Medicare. The only exception to that is if you're not eligible for a premium-free Part A, which is typically folks who have not worked the 40 quarters, or your income is too high, you can, you may be able to get some assistance there. And there is a handout in the things that you were sent out that explains that. So, how do you want to roll in your Medicare supplement plan? First of all, there's a number of choices. You want to look at the benefits that a plan covers, and the pricing, the financial stability of an insurer, the supplement underwriting policies, if applicable. And typically, you can sign up for the first 6 months on a Medigap policy and not required to give you any health history. After that, you will, and that's the first 6 months after you sign up for Part B Medicare. Medicare supplement plans are sold by insurance brokers, and there are different plans, and each plan has a different set of benefits. There's a standard set of benefits that the federal government sent some time ago that each plan may or may not give. So you want to talk to your insurance broker to see which one fits. And as Jim mentioned earlier, if you want a G plan, for instance, you could be paying very different amounts at different insurance companies, but still getting the same benefits. So you do want to do some homework. There is a chart of that in the Medicare and You book. When you do receive it, it will give you a chart of how all the different alphabets of the supplement plans are and what's covered. And then, as I mentioned, you enroll through a licensed broker, or you can call directly to the insurance company, and you want to find one that will have is authorized to sell various plans as opposed to just one insurance company. So when can you buy the Medigap? Within 6 months of enrolling in Part B is your Medigap open enrollment period. In other words, there's no restrictions. If you want to purchase it after the first 6 months, you may be subject to medical underwriting, which I mentioned before. But there are some circumstances if, for instance, you lose your health insurance, group health insurance, and based on either on the federal or state law, you may or may not, you may have some different, different subject, you may have some different underwriting. So how do you enroll in Part C or Part D at 65? We encourage you to take a look at each plan's benefits and costs. They basically want to look at what their actual Medicare medical care, such as hospitalizations and outpatient visits, etc., as well as their medication drug cost. Each plan has a different formulary, and the formulary is the list of drugs they cover. We want to be sure that your drugs are in that formulary, and you want to evaluate what extra benefits they have. part of the counseling with PA-MEDI is that we're able to help you look through the plan finder on the Medicare website to pull up and look at different plans that meet your needs. We also have access to a software that can take a look at some of the costs for your Medicare supplement plans. So that's something to look at. But again, the Medicare supplement plans, you'll have to speak to an insurance broker. So your enrollment options, as I mentioned, you can go to the Medicare Plan Finder on medicare.gov yourself. You can call the plans themselves and enroll by phone. You can work with an insurance broker. And if you're looking at a Medicare Advantage plan or a prescription drug plan, you can make an appointment with a PA-MEDI counselor and we can help you sort through the Medicare website. So when do you want to enroll in your Part C or your Part D plans? We want to sort of plan it, start the process a couple of months before the effective date of when you want them to start. Normally you want to start it so that your group health insurance from your employer is going to end one day and your Medicare is going to start the next. So a lot of questions have been getting a lot more of them over the last couple of years, and that's what if I'm still working? Do I need Part B? I'm going to have group insurance when I retire. So you can enroll in Part B. You could not enroll in it initially because you've got coverage, but when that coverage ends, you have 8 months to sign up for your Part B. And you can do that online or by submitting paper forms, and you can get both at the Social Security line at ssa.gov, or you can do the paper forms to the SSA office. There's two different forms. One is the Form 40B, which is basically you're identifying yourself and your information. And then the L564 is a documentation that you get your employer to sign to verify that you've been employed in the dates of your employment. And it's important to, if you're doing the paper form, to do it submit them together. It is fairly easy to do it online, but either way, you can work with a PA-MEDI counselor to sort through that process. Same thing with Medicare Advantage Part C and D. What if you're still working prescription drug plans and Medicare Advantage plans? You can enroll up to 63 days after your group health insurance ends. And you can enroll through the Medicare website Plan Finder. You can talk to an insurance company directly, or you can work with an insurance broker, or we can help you sort some of it out also. So there is a general enrollment period for Medicare. And what the general enrollment period is for is if you've missed your initial enrollment period or have a delayed enrollment because you've had group coverage past 65. That general enrollment period is January 1st through March 31st. And you just need to know if you have delayed enrolling in Medicare programs, there are late enrollment penalties that may apply depending on the length of time you've been without credible insurance coverage. And the late enrollment penalties do affect Parts A, B, and D. And they're usually a monthly penalty based on the length of time that you were without the credible coverage. And that's added on to your regular premium. And the example there is if you waited 12 months, 12 months late enrolling in Part B or Part D, you would have additional penalties of $17 a month for Part B and $4 a month for the rest of your life for Part D. So it really is an incentive for you to get this paperwork done on time and enroll in a timely fashion. There is an annual open enrollment period where you can switch your Medicare Advantage plan or your prescription drug plan. And that runs between October 15th to January 1st. Excuse me, till December 7th, and then the coverage begins January 1st. And we have extra appointments at all the senior centers and other sites that we cover, for instance, like the library, that you can make appointments to come in and talk to a PA-MEDI counselor to go through open enrollment and help you decide what your next steps are. I can't encourage you enough to do this. Plans change every year, and sometimes the changes can be dramatic, particularly with the Part D plans. The prescription drug plans have always have different pricing with them as the year changes. I can tell you that I've been on Medicare for a number of years, and I only had the same plan 2 years in a row once because of the changes in the cost of my drugs per plan. So just absolutely do it. You will save yourself some money and heartache if you don't do it. And there is an additional Medicare Advantage open enrollment period when you can switch or disenroll in your Medicare Advantage plan. And that's January, February, and March. That might be something would happen is, say you signed up for a Medicare Advantage plan during open enrollment, you thought it was better than the one you had, and you realized at January 1st as things were happening that it's not. Or for instance, for your physician dropped your Medicare Advantage plan and is moved to another Medicare Advantage plan. So you might want to switch to that plan. So that, and again, PA-MEDI is available to help you sort through that. There are some other enrollment periods that have to do with certain event times that allow you to join, switch, or stop your Medicare company coverage. And these listed here are some of the common ones. Say, for instance, you qualify for a federal or state assistance program. You're moving out of a service area of your existing plan. You either are losing or dropping a non-Medicare coverage, such as your employer retirement plan, or you, if you have a 5-star drug plan or 5-star Medicare Advantage plan, you can change. Unfortunately, in the state of Pennsylvania this year, we don't have any 5-star plans, but that could change next year. There are some programs that can help you with your Medicare cost. They're based on income. The Medicare Savings Program is something that helps you pay your Part V premium and some of the Medicare cost sharing. You would apply through the Chester County Department of Human Services. There's a website there. And that would also include a Medicare Savings Program, if you qualify, would waive any penalties that you have for Part B or D. There's a program called Extra Help, and Extra Help is to lower or eliminate your Part D premium and deductibles, and helps you get low-cost prescription drugs. You apply through the Social Security Administration. And then there's PACE and PACE-NET, which is the Pennsylvania drug prescription program for seniors. And you have to be 65 or older, and you can actually apply on the phone through PACE. Any of these programs we can help you apply for. Just make an appointment with a counselor and come in and we'll help you get started. So we've kind of gone through all the two various ways that you can take Medicare: old original Medicare with Part A and B, a Medigap or a Medicare supplement plan, or retiree or VA TRICARE coverage and a prescription drug plan, or the Medicare Advantage route with still having Part A and B and then signing up for private insurance Medicare Advantage plan. So again, there's help available through PA-MEDI. You can schedule an appointment through your local senior center or other counseling site. There is a full list on our website, or which is listed there, chesco.org/477/PA-MEDI. or you can call our helpline at 610-344-5004 and select option 2. Just leave your name, just briefly what you're calling about, phone number, and it would be very helpful times that would be good to call you back. And we do try to respond to you within 24 hours. Or you can email smilam@chesco.org and she'll try to reach you also within 24 to 48 hours. We always like to do a little advertising for Chester County. There's lots of opportunities for volunteers in Chester County. These are just some of them. If you're interested, you can call the number at the bottom of the screen, the 610-344-6350. And I do see there's a question in the chat. Let me bring it up if I can. But let me just read it. Says, I'm 65 at the end of September. I was told I could apply at the beginning of June. However, the phone message at Social Security said I must be 64 years and 9 months, which would be the end of June. This is my first hearing of something like that. Jim, have you heard anything like that?
Jim, we can't hear you.
Yeah, we can't hear you, Jim. Did we
How's
lose
that?
There we go.
What was his birthday month?
His birthday month is September, the end of September.
So you go back 3 months. I would think he wouldn't have a problem signing up in June. But
that he
I
wouldn't.
would suggest, well, June, July, and August is 3 months before your birthday month.
But Social Security messages telling him that he can't sign up till he's 64 and 9 months. But
Yeah.
that's June. Probably they're going specifically by your birth date. If your birth date's the end of September, that's why they're saying the end of June. That makes the months.
Yeah.
I don't know if
But,
that
you know,
makes
you can
sense.
always go online at the beginning of July.
Yeah.
I mean, your coverage begins on the date you make the application. So, you know, if for some reason the paperwork gets tied up or our Social Security office locally has, you know, people retire and they can't help you, and it takes for a couple of months after your birthday month when you wanted to sign up, no problem. They'll backdate everything to the date you want. So
Exactly.
I would wait, you know, I'm not sure why you got this. I've never run into it, but I would wait till the 1st of July and go online at ssa.gov.
Right. You can get it taken care of then, and then it's effective the September 1st. Your birthday.
Correct.
Any other questions? I don't see hanging any in the chat. Okay, well, okay, here comes one.
It's a thank you.
It's a thank you from Howard. Thank you, Howard. Good.
Oh, you're welcome. All right. Good luck, everybody.
Okay.
Thank you for your help
Thank you,
tonight.
Linda and Jim, for the presentation, and thanks everyone else for joining us tonight.
Good night.
Good night.
All right, we will sign off. Good
Thank
night,
you.
everybody.
Thank you.